Hi, I'm Dr. David Green, CEO of Preferred Pain Center here in Phoenix and Scottsdale, Arizona. Today I'm at the Heard Museum, which is the Southwest premier cultural center and art museum for the Native American culture. It was started back in 1929 by the Heard couple, Dwight and May, and unfortunately Dwight passed away a few months before the museum opened. May continued on with the dream, very humble opening. It was probably less than 10,000 square feet in the building. And since then, the museum has doubled in size probably 3 times, to where the latest addition from 2000 to 2010 was about $8 million and over 20-some thousand square feet. They have artifacts here of the Native American culture, permanent art, as well as rotating exhibits. They have a courtyard in the back with some water functions. There's an amphitheater out here in front of us. And they actually have a second museum in North Scottsdale, which is the Community Museum. At any rate, it's a wonderful museum. It's a great testament to Native Americans, and it allows for an accurate portrayal of where Native Americans in this country have been, where they are, and where they're going. So the topic for today is, how do pill mills in the U.S. differ from comprehensive pain management centers? Well, there's really about 5 main differences between them. Unfortunately, pill mills in the United States have a terrible reputation, and they deserve it. But what they've done is drag down the reputation of legitimate comprehensive pain management centers. And they don't deserve a bad reputation. So let me explain some of the differences. One of them is that pill mills often see patients same day. You really don't need an appointment. You just walk in, give them your name. It might as well be like going to get a haircut at Great Clips. Don't need an appointment, just show up. Wait 20 minutes, get your prescription or haircut, and then, see you later. See you in a month. It shouldn't be like that, okay? A comprehensive pain center needs an appointment. They are busy. They need time to either look at your medical records, pull your chart. They need to either verify your insurance, and it just works more as a regular medical practice. Sure, if they have a cancellation, an opening, and you're an established patient, yeah, but I think you get the drift of, it's not really just a going into like a Great Clips. Another one is the quality of the physicians that you're seeing. At a comprehensive pain management center, these are doctors who do this for a living, meaning they're either board certified and or fellowship trained, and they've learned all about the various aspects of pain management, and not just how to write a narcotic prescription. They know when a patient needs physical therapy. They know when a patient might benefit from chiropractic or spinal decompression or interventional treatments to help them get better. Big difference between the quality of the physicians, by and large, that you'll see between a pill mill and a comprehensive center. Another one is, there are surveillance methods that are typically utilized at a real comprehensive pain center that aren't often seen at a pill mill. One of those would be urine drug testing. Very important to surveil the patient to see if, in fact, they are sticking to the treatment plan, or are they utilizing illicit drugs as well. For instance, they may be getting the prescription from the pain doctor, going out and selling it, getting heroin and cocaine, and then using that, and then maybe keeping the rest of the money. So they're making a good living off of the pain doctor, and they're utilizing illicit drugs. Urine drug testing can show that. So second one is pain agreements or contracts, or however they want to refer to, but essentially it's an agreement that the patient will sign saying that, I'm not going to divert my medication, I'm going to use it as prescribed, I'm not going to take more than what I'm prescribed, and also I will be available on whatever notice to come in for pill counts, to make sure that I am abiding by the treatment plan. It makes the patient an active participant in his or her care, much more so than just a pill mill, the way that they go about doing it. And the third one is the pharmacy database, where patients get their pain medication prescription, they go to a pharmacy, and the pharmacy reports that to the state. About 31 states do it now, and pain doctors at pain centers often will check that to make sure that the patient is not doctor shopping. Which brings me to the next difference between pill mills and comprehensive pain centers, is insurance. Insurance is a typically accepted practice at a comprehensive pain center, meaning that most of the patients that come in have insurance and they use it. You know, and at a pill mill, oftentimes it's cash fee-for-service. They're using their insurance somewhere else, and they're going to a pill mill and paying cash. So they're double dipping on the pain medications that they get. Very bad practice to do. You can sometimes catch that unless the pharmacy that they're going to when they use cash does not participate in reporting to the pharmacy prescription database. And I guarantee you in the illicit community that those pharmacy names get around. So the most important fifth difference between pill mills and comprehensive pain centers is the breadth of services that's provided. Let me give you an example. Pill mills, you go in, you get seen, the two decisions that are made are which kind of pain medication and how much. At a pain center, it's much different. It's not just if narcotics are going to be applicable, but what about interventional pain treatments? Oh, and what about physical therapy and chiropractic and spinal decompression or acupuncture, massage? That's what, say, Preferred Pain Center as a comprehensive pain center offers. Very different than a pill mill. They're looking out for the total patient, what's going to help with function, not just pain, because it may be that the pain, you can't get rid of it all unless you give too much narcotics. And at a certain point, the pain is here, and at the same level of narcotic, the pain may go up here, so you need more narcotic. The pain may start to be, you know, it's a spiral that you want to avoid, and that's called tolerance. So if you can get the patient involved with other treatments to avoid the tolerance issue, that's what's best for the patient. That's what Preferred Pain Center does. Check us out on the web at preferredpaincenter.com. Lots of animations, videos, testimonials. We also have a guarantee. We'll see you within 24 hours and get your pain treatment started. I'm Dr. David Green, Preferred Pain Center. Your pain stops here.